A very common phenomenon we hear about now in the news is the hMPV virus. So, let's dive in and learn more about it. Human metapneumovirus, hMPV, is a respiratory virus first identified in 2001. Researchers at the Erasmus Medical Center in the Netherlands discovered it while studying respiratory samples from children with acute respiratory illnesses. Later they get through further studies showing that this virus wasn't new at all. It had been silently circulating in humans for decades before its official discovery. Now, when it comes to its origins, genetic studies traced hMPV back to a common ancestor it shares with avian metapneumovirus, hMPV. This points to a possible zoonotic origin. Yep, it's likely that at some point in history the virus made a jump from birds to humans. Fast forward to today, hMPV has become one of the leading causes of respiratory infections globally. It hits hardest during the winter months and tends to affect young children, older adults, and those with weakened immune systems. Global situation at present. Let's take a quick tour of how the hMPV virus is making its presence felt around the world. Let's start with China, which is currently dealing with the biggest hit. In December 2024, the northern provinces saw a sharp rise in respiratory infections, and hMPV is playing a big role in this. Hospitals are under pressure, especially in areas where winter amplifies respiratory illnesses. It's the kind of surge you expect during this season, but hMPV is adding a layer of complexity. Moving to the UK, since October 2024, there's been a steady rise in hMPV cases. The UK Health and Security Agency says this year's numbers are slightly higher than last year's. Most cases are showing up in young children and people with existing health issues, making it clear how much of an impact this virus has on the most vulnerable. Across the Atlantic, the US has also seen a climb in hMPV cases since November 2024. By the end of December, almost 2% of respiratory tests were positive for hMPV. Northern states like Minnesota and New York are seeing more cases. No surprise there with the cold weather. And here's the tricky part. Hospitals already dealing with flu and RSV are now facing this new challenge. And here's some recent news from India. January 2025 marked the first confirmed hMPV cases in the country. 7 people tested positive, but health officials are staying calm. They've launched awareness campaigns to ensure people know about this virus and how to protect themselves. It's early days for India, but they're keeping a close eye on the situation. Let's know in details what happens when someone gets infected with hMPV. It's not pleasant, but understanding it helps. Usually starts with a dry, nagging cough that seems to come out of nowhere. You might feel like there's a tickle in your throat that just won't go away. Along with that, there's the dreaded fever. Your body heats up, making you feel sluggish, achy, and downright exhausted, like you're carrying an invisible weight. Then comes the sore throat. Imagine that burning, scratchy sensation every time you swallow, like your throat's been sandpapered. And let's not forget the nose, either completely blocked, making you sound like a robot, or dripping constantly, keeping tissues within arm's reach. As the virus settles deeper into the respiratory system, things can get worse. Your chest might start to feel tight, making it harder to take deep breaths. If it progresses to bronchitis, it feels like a weight sitting on your chest, with persistent coughing that doesn't give you a break, even at night. For some, especially infants and the elderly, hMPV can go even deeper, into the lungs, causing pneumonia. That's when things turn serious. Breathing becomes shallow and labored, like trying to inhale through a straw. The lack of oxygen might make you feel dizzy or lightheaded, and in severe cases, it can leave you gasping for air. What's unique about hMPV is how it preys on the most vulnerable. Little kids with tiny airways, older adults whose immune systems aren't as strong, and people already dealing with health conditions. For them, what starts as a simple cold can quickly escalate into a dangerous battle for every breath. So, if you're experiencing any of these symptoms, especially if it's hitting your chest hard, it's always a good idea to get checked out early. How to protect yourself and others from hMPV. So, what can you do to avoid catching or spreading hMPV? Well, it's all about the basics. Health authorities recommend sticking to good hygiene practices, which can make a big difference in stopping the virus from spreading. First off, hand washing is your best friend. Just like with any respiratory virus, make sure to wash your hands frequently, especially after coughing, sneezing, or touching things in public spaces. We've all heard it 1,000 times, but the simple act of scrubbing those hands with soap and water for at least 20 seconds can go a long way in keeping germs at bay. Another key tip: if you're not feeling well and showing flu-like symptoms, it's better to stay home and avoid crowded places. I know it's tough to miss out, but think of it this way. By resting and staying away from others, you're helping prevent hMPV from spreading further, especially to those who might be more vulnerable like older adults or little kids. Right now, there isn't a specific vaccine or antiviral treatment for hMPV, which means prevention is really in our hands. Literally. If you catch it, doctors mainly focus on supportive care to help you recover. That could mean staying hydrated, resting, and using fever-reducing medications to make things more comfortable. It's pretty much the standard approach for most viral infections. So if you do end up getting sick, keep things low-key, listen to your body, and don't hesitate to seek medical advice if things get worse, especially if you're having trouble breathing. Could hMPV cause a global crisis like COVID-19? Right now, it's unlikely that hMPV will cause a global crisis on the same scale as COVID-19, and here's why. It's not as contagious as COVID-19. hMPV primarily spreads through respiratory droplets and aerosols, similar to other respiratory viruses, but it doesn't seem to spread as easily or as rapidly as COVID-19 did. While hMPV can infect many people, especially during the colder months, it's not quite as efficient in terms of transmission. It doesn't cause the same level of severe illness in most people. For the majority of people infected with hMPV, the illness tends to be mild and similar to a common cold. While it can lead to more serious conditions like pneumonia, this is generally more common in vulnerable populations, young children, elderly, or those with weakened immune systems. COVID-19, on the other hand, caused severe illness in a larger portion of the population, even in people without underlying conditions, leading to widespread hospitalizations and, unfortunately, many deaths. It doesn't have the same global spread potential yet. While hMPV is making headlines now, it hasn't been spreading at the same global level as COVID-19. COVID-19 rapidly crossed borders and affected nearly every country, leading to lockdowns and global disruptions. hMPV doesn't seem to have that kind of immediate and widespread impact. Yet, there's no need for lockdowns or drastic measures, yet. Unlike COVID-19, which led to massive social and economic disruptions with quarantines, travel restrictions, and public health measures, hMPV doesn't yet demand these extreme actions. It's more of a seasonal concern right now, similar to the flu, where basic precautions like hand washing and staying home when sick can help keep it contained. However, it's not to be ignored. Even though it's unlikely to be as disruptive as COVID-19, hMPV could still strain healthcare systems, especially during peak seasons. Vulnerable groups could suffer more severely, and a sudden rise in cases might push hospitals to their limits, especially in areas where healthcare infrastructure is already stretched thin. So while hMPV is serious and should be taken seriously, it doesn't have the same pandemic potential as COVID-19, at least not right now. To wrap it up, while hMPV is a serious virus that can cause significant health issues, especially for vulnerable populations, it's unlikely to trigger a global crisis like COVID-19. Its spread isn't as rapid or widespread, and it generally causes less severe illness for most people. That said, it's still important to take precautions, good hygiene, staying home when sick, and looking out for those most at risk. Like many respiratory viruses, it's something we'll need to keep an eye on, but with the right measures in place, we can prevent it from becoming a larger-scale threat. Stay informed, stay safe, and let's hope it stays under control.